You're never going to believe what this JAMA study just found about Ozempic. So researchers looked at 60,000 adults that had obesity or type 2 diabetes and then looked to see what were their cognitive impairments 7 years down the road. They found that those that were taking Wegovy or Ozempic had a lower risk of dementia, stroke, and all-cause mortality, aka death. However, there was no major difference in the risk of things like Parkinson's or hemorrhage. The one other interesting point that they noticed was that this was more effective when it came to women who were over the age of 60 and typically with a BMI that was between 30 and 40. However, it is important to note that this was not a clinical trial and instead more of an observational study where they looked at individuals who were taking it and then looking at their risks later on in life. However, this continues to grow with some of the evidence that things like these GLP-1 agonists like Ozempic and Wegovy may have outside impacts besides just diabetes and weight loss. For more information, I'll be doing a full breakdown on my Substack, which you can find in the link in the bio, or if you want to help support the page, there's some ways for you to do that as well. Stay tuned for a follow-up on the rest of the day on a 60 seconds or less video.